Hi there! Have you ever wondered what conduct disorder is? Well, I'm sure you are now because I just said it. So let's talk about what it is exactly. For starters, did you know it's actually a mental illness that can affect up to 10% of youth each year? Did you say mental illness? But isn't there stigma with that? Well, actually, stigma are negative stereotypes that can prevent people from seeking treatment and in achieving a more complete and satisfying life. So let's get the facts straight first.
Because of the aggressive and destructive nature of conduct disorder, outsiders often assume that families of affected youth are chaotic, dysfunctional, and filled with interpersonal conflict. The tendency to blame child misconduct on poor parenting results in the failure to seek treatment. So rather than making assumptions and falling victims to stigma, we should educate, support, and encourage treatment. For example, in schools, teachers responsible for the care of affected children should collaborate with parents in facilitating positive outcomes. Through awareness and education, we can influence caregivers to take advantage of child mental health services.
So what exactly is conduct disorder?
Conduct disorder can be defined as a frequently occurring psychiatric disorder that is characterized by persistent patterns of aggressive and non-aggressive antisocial behaviors and deception. The population that's affected includes imprisoned youth who have a higher rate of conduct disorder, boys tend to have more frequently diagnosed than girls, and adolescents who appear to have a higher prevalence of conduct disorder compared to younger children. According to DSM-5, symptoms include aggression towards people and animals, destruction of property, deceitfulness or theft, serious violation of rules, and disturbance in behavior that causes clinically significant impairment in social, academic, or occupational functioning.
In Canada, up to 4% of 9 to 17-year-olds are diagnosed, and it is more common in boys than girls and cities than rural areas. In the United States, up to 9% of 9 to 17-year-olds are diagnosed with conduct disorder. These numbers are approximate as comorbidity with other disorders is common. Awareness is important to enable early diagnosis and treatment, allowing for the greatest opportunity for success. With proper diagnosis and treatment, a child is able to navigate developmental milestones leading to successful adaptation to adulthood. Earlier implementation of treatment equals better outcomes.
So what if you don't seek treatment? Well, there's going to be ongoing problems in the future, such as not being able to adapt to adulthood, facing problematic relationships, having a difficult time holding a job, and having an increased risk for substance abuse and problems with law enforcement, and even developing a personality disorder in the future. So bottom line is, earlier treatment is always better. So what exactly does treatment look like?
Treatment involves a child speaking with a licensed and trained mental health care professional who helps him or her identify and work through the things that may be triggering the conduct disorder. The goals are to help the child learn to control and express anger in more appropriate ways that do not harm themselves or others. Psychotherapy is a common treatment choice. This includes cognitive behavioral therapy, which aims to reshape the child's thinking to improve problem-solving skills, communication, anger management, and impulse control. Another form of psychotherapy includes problem-solving skills training, which helps suppress undesirable behaviors and creates structure in a child's life that provides security to build positive relationships as therapy progresses. There's no medication formally approved to treat CD, but various drugs may be used to treat some of its distressing symptoms. Stimulants, antidepressants, lithium, anticonvulsants, and clonidine have all been used in the treatment of conduct disorder. By improving attention and increasing inhibitory activity, medication may improve children's capacity to benefit from other psychosocial intervention.
So overall, don't let stigma stop you. And why should mental illness be viewed any differently than a physical illness? Just remember, whatever the mental illness, even for conduct disorder, that help is always out there. You'd be surprised by the amount of support you can get if you're just willing to take the first step to ask for it.
Created using Powtoon.